The Government and Ministry of Health will today announce any alert level decisions and changes for the country. It follows an announcement yesterday that scanning into a business will be mandatory at all levels. Joining us now is the Associate Minister of Health, Dr. Ayesha Verrall. Morena, Minister, thanks for coming on the program.
Morena, Ryan.
Have you got any update for us overnight? Are you aware of any new cases?
No, my update won't come through to a little bit later today, so nothing further to update you on, sorry.
All right, so you're not aware at this point if there's anything extra to add?
No.
Okay. Of those cases we do have, how are they doing? Is anyone sick or ill? Have we noticed an uptick in hospital admissions?
Yeah, you heard from the Director General yesterday that 5 of the cases are in hospital, none are in ICU, So reassuring that they're not in ICU, but does underscore that this is a serious illness and the importance of the current measures that we're taking.
Do we have any update on, given how many cases we've got, more than 70 now, and the locations of interest, any idea of how big this cluster could grow to? What's your latest advice on that?
Yeah, so, I think the thing that we keep repeating is that when you start a lockdown, things get worse before they get better, and that's because the cases you see relate to transmission that happened probably still prior to lockdown. So we're still seeing that working its way through the system. I think it's still possible that we see a higher number of cases today than we have on previous days, and it may yet be a few days before the curve starts to bend down.
Do you have any advice on how big the cluster could grow to?
People model things, and you would have seen Professor Hendy's modelling in the media saying this could be 100 or more cases. But I think the point is here, it really depends on how we go with the response, and that's why it's so important that people get tested. We've had excellent response to the call for testing. In some parts of Auckland, we've got 5% of the population tested. That's massive. And some previous outbreaks we've shot for 1%, but to get 5% is really great. So it's just really important that we continue to make all our efforts to find people and, of course, to stay at home, so that if you are one of the people in the cluster, someone who doesn't yet know that you're infected but are incubating the virus, it doesn't spread any further beyond you.
Just with the testing, some of those who have been tested, albeit we're getting record numbers done, say they've been waiting like 4 or 5 days to have a result, still haven't had a result. Do you know what the average wait is at the moment?
Yeah, I don't have the average wait, but I can tell you that what we do with testing when demand is really high is we do prioritisation. So that means that the highest risk samples are handled really quickly, and and the other part of it is that if someone has a positive result, the laboratory scientists will pick up the phone and call the public health unit right away, and they'll start to act on it so that there's no further spread. Sometimes there is a delay in issuing negative results to people, and that's because of the many, I think it's over 100,000 tests that have been done.
Is there anything you've been told from your officials at the moment about either the contact tracing or the testing that's going on that's given you cause for concern?
Look, I think overall I'm pleased with how the response is going, but yeah, we're in a situation where we need to be very cautious, and we are making sure that we're adjusting the response as we go to deal with these pressures. And you've touched on it already this morning, some of the pressures around testing demand. And we also we've cast a really wide net with contact tracing. We need to make sure that we're managing those people through the system, but also focused on where the virus might be going next.
Okay, so are we managing that well? Because the gold standard is to contact, I think, 80% of contacts within 48 hours. Where are we at the moment?
Yeah, so we've been going over some of those metrics, which were metrics that came from my report last year, in light of some of the changing situation. I think there's a couple of things to think about with that. One is when we're doing this sort of wide-scale location of interest type of contact tracing, where we're tracing, we have 10,000 people in the contact tracing system. We're working in a slightly different mode here. But the other thing is that Delta does also change many of those goalposts that I set previously. Previously, I had said that we could turn around an outbreak with contact tracing alone. I think for Delta that actually isn't possible anymore, and we do need to be at high alert levels while we do contact tracing.
So what does that mean for our gold standard of 80%? Where is that percentage now if the goalposts have changed?
Yeah, so we know that
where are we performing?
People... Yeah, so I don't have that data today, but I can tell you that for the people who are household contacts of the people, of the known cases, we have a high rate of completion of the contact tracing for those people. But we're kind of doing industrial scale contact tracing with these locations of interest, and in that situation, some of the reporting issues need to be worked through, so some of the data issues there.
Right, so you can't say, what are we now, day 6 of lockdown? 5 of lockdown? You still don't know how well we're performing with contacting those who are potentially at risk of COVID.
Yeah, so I think you'll see a whole lot of things that support the fact that the contact tracing is happening in a really timely way. So, for example, we start off each day with unlinked cases when cases are first diagnosed, and they're linked to the cluster sort of within. By the following day, and we don't have mystery cases coming on through. So I think the contact tracing is performing well, but we don't have a report for those 10,000 people identified from different locations of interest on the timeliness of that. However, in many cases they relate to schools, for example, where so we have several thousand from schools that are locations of interest, where the public health advice to those people goes out immediately. So the moment a school case is identified, the public health unit advises the school community through the school, and people get advice on the isolation and testing that way.
Sure. Minister, we've got a lot of people who are interested in the information that's going to come out this afternoon. The South Island in particular, there are some experts now saying that they could be lowered to alert level 3 later in the week. What's your feeling? What's your sense? Give the people in the South Island this morning a bit of a sense of your thinking.
Yeah, so I think one of the things to remember is we're on day 6 of lockdown, and we have a situation in Auckland where we had a large number of potential exposures of interest, and not everyone at those locations of interest can be identified, right, because they're large public places. And so we also know that maybe in the time from when the case was first ill through to when Auckland went into lockdown, over 10s of thousands of people left Auckland to destinations all around the country. So we know some of the contacts, but we may not know every case where every exposed person went in New Zealand, and so that's the risk that we are cognizant of when we think about alert level changes. All
right, on vaccinations, Minister, a lot of people are now saying, where's my vaccine, and why don't I have it by now already? We're doing 50,000 a day at the moment, which is fantastic. That is really, really excellent news, and I think we should commend our vaccinators for that effort. But I guess the question people have is, when will we all, everyone who wants one, when will we all be vaccinated? It's going to take months, isn't it? If we did 50,000 a day based on those numbers and based on the number of people that still need to be vaccinated, which was about 60% of us who have not had a single jab of those eligible, it's going to be months, isn't it? Is there anything we can do to speed that up? Have you asked for more vaccines? Scott Morrison in Australia has ordered 1 million from Poland and they've arrived this week. Have we tried to get more?
Yeah, so we're in constant conversation with the drug companies about supply, with Pfizer about the supply of the vaccine, and we have based our plans around that. And the plan is very much that we will be able to offer everyone a vaccine this year. To do that, you're right, we have to lift the rate just a little bit above where we are, but we've shown that we've been able to scale the campaign as more suppliers come on.
So
my message to New Zealanders about this is almost everyone is eligible to book, if not right now, in the coming few days, and just get online and book your vaccine.
Minister, just so we're clear, we have asked for more vaccines over and above what we'd already ordered. We're going to the likes of Poland, we're going wherever we can to find more vaccine.
I'm not sure if we've talked to Poland. I can't rule it out. But look, I think I assume your question here is, can we vaccinate our way out of this outbreak? And the fact is you can't. You can't do that, because the time it takes for the vaccination to be effective would be time in which the outbreak would get away from you. So I don't think the strategy that Australia is taking with...
Yeah, sorry, Minister, that's not the question. How do we vaccinate out of this outbreak? It's how do we vaccinate out of the next one? Because that's the problem we've got, isn't it? We still have vaccination rates that are so low that using this herd immunity thing, whether it works or not, isn't even an option in 2 months' time, because we still won't be there. So have we asked for more vaccines? And if not, why not?
Yeah, so we've been really forward with pharmaceutical companies, both in the past and ongoing, about how much stock we can get, and we've had a plan for vaccination across this year based on what we've secured. There is certainly no sitting back about that. We are front-footing it with the drug companies about this year's program, but also with respect to any future needs we have beyond this year.